Good day everyone, welcome to H5N Physiotherapy channel. Today we'll be discussing about RPM. This stands for Relaxed Passive Movements. Relaxed passive movements, they are the passive movements. Means in this the patient does not use his or her own efforts to perform the movement, and the movement is performed either by the therapist or by the mechanical devices. So relaxed passive movements, they are the passive movements performed within the limits of pain and available range of motion. These movements, they are performed accurately and smoothly by the physiotherapist in the same range and direction of active movements. There are a few principles of giving relaxed passive movements. Most importantly, number one is suitable starting position. So the starting position, it should be such that the patient is fully supported, comfortable, and easy for execution of required movement. Another principle is counseling of the patient. Before giving the RPM, the therapist must explain the patient regarding his illness, technique, and the effect of the treatment so as to ensure the full cooperation from the patient. Third principle stands for relaxation. So the selection of a suitable starting position, it ensures comfort and support, and the bearings of the physiotherapist will do much to inspire the confidence and cooperation in maintaining the relaxation through the movement. So another principle is to ensure that the movement to be localized to a specific joint. So fixation, the bone which lies proximal to it is fixed by the physiotherapist. Another principle is support. So full and comfortable support is given to the part to be moved so that the patient has confidence and he will remain relaxed during the treatment session. The stance of physiotherapist. Now the therapist stance, it must be firm and comfortable. When standing, the feet should be apart and they should be placed in line of the movement. Another principle is proper grip. So the physiotherapist grasps the part firmly but comfortably in her hand, and it may be supported by the axial suspension in slings if the weight of the patient is not managed by the physiotherapist. Another principle is traction. So many joints, they allow the articular surfaces to be drawn apart by traction. So traction, it is thought to facilitate the movement by reducing any intra-articular friction. And the range of movement, so the range of movement is as full as the condition of the joints permits without eliciting any pain or spasm in the surrounding muscles. So it should be always in a pain-free range. And next principle will be the speed of movement. So as it is essential that the relaxation should be maintained throughout the movement, so the speed must be uniform, fairly slow, and it should be rhythmical in manner. Now the repetition depends on the effect desired or on the purpose for which we are using the relaxed passive movements. So these are the basic principles of giving.